as I do often when I talk about my identity, that I am not a recent immigrant. My family is not of recent immigration. And so I really try to have space and have the folks who are experiencing that be in those leadership positions. But I see my role as supporting that. And why this is meaningful to me as a Black woman is that I think anytime we say that a group of people doesn't deserve things like healthcare, that a group of people can literally die because of a piece of paper, I know as a Black woman that can ultimately impact me as well. And these things are not separate. So if we can say some people are less than human and don't deserve care, that can eventually and likely will mean Black women don't deserve care. And it does in this country often.
Hi friends, welcome to Public Health Careers. I'm Omari Richards, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Rayna Hetlage, MPH. Rayna is the Director of Political Strategy at the Center for Health Progress. Rayna is also the Board Chair of the Health Insurance Affordability Enterprise. She's a dedicated leader driving transformative change in the health policy sector, driven by the firm belief that each one of us has the power to affect meaningful change. She takes great pride in her work to foster inclusive policy spaces and community-led decision-making. She conferred a Bachelor of Science in Public Health at the University of Arizona, then a Master of Public Health in Health Systems Management and Policy at the Colorado School of Public Health. In today's episode, you'll hear and learn more about community power building, why community organizing and representation are essential for creating meaningful change in the policy and advocacy process, why staying true to your values is important in public health and health equity work, the important advocacy work she was a part of in Colorado, focused on expanding health insurance coverage for undocumented immigrants, how Rayna got a Master's of Public Health for around $3,000 utilizing workplace employer benefits programs, and why building relationships and leveraging connections can open doors and create opportunities in your public health journey, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
Hey, this is Rayna Hetlage. I am a Director of Political Strategy, and you are listening to Public Health Careers.
Rayna, I'm excited to have you on the show today and for you to share your experiences with us. So welcome.
Thank you. I'm excited to be here.
So jumping into things, how do you identify, and tell us a little about your personal background?
Yeah, so I identify as a Black woman. I use she, her pronouns. So my background, I grew up in Portland, Oregon, and I moved to Arizona when I was in high school, which was a big culture shock for me, having grown up in Portland. And then went to undergrad in Arizona in Tucson and moved to Denver, Colorado, just as I finished up my undergrad. So I've been around the West. I studied abroad in Copenhagen, Denmark. Yeah.
What was that culture shift and that change like for you going from Oregon to Arizona?
Oh, it was wild. I mean, I think growing up in Portland was I was surrounded by a lot of progressive folks. There's a lot of culture around protest and direct action. And, I moved to Arizona at the time when Sheriff Joe Arpaio was there. There were all of these check your papers laws happening. And it was a big shift for me from being somewhere so progressive to somewhere that is very conservative, and just experiencing the things that I believed in being kind of weird to my fellow classmates. But I've always been super vocal anyway. So probably contributed to the culture shock.
No, and I mean, maybe even to that point, because maybe someone listening to this has changed situations and they are going into a different environment. How did you approach that, given that you still wanted to be an advocate and speak on the things that were important to you?
Yeah, I mean, I think, I've always had a very clear, these are my values and who I am, and have tried to find people who align with those, while also, and I'll say my grandmother, I think, really instilled this in me, being able to listen and take in the perspectives and background of other folks, because you never know when you might be wrong about something. You might be exposed to something new that you haven't experienced before. And it's, great to keep an open mind while also I think knowing who you are as a person is really important so you can come back to those values when things are difficult, so you don't just get kind of pulled whatever direction you're going into.
And then shifting gears a little bit here, you were part of the Colorado option where you successfully advocated for centering health equity in the legislation, which led to Colorado creating the first in the nation health insurance plan designed by community leaders with a focus on improving health equity. Tell us about this experience.
Oh, that was so exciting. Yeah, I mean, I think I'd been in policy work for 2 years at that point, and this had been an effort to have a public option in Colorado that had started before I started working in policy. And so I kind of joined as there was a discussion about, it didn't pass in 2020 because of COVID and the session being condensed here. And so we went into the fall of 2020 and planning 2021, the legislative session. And there was like, what is this going to look like? And I came into this space, as one of the only people of color in this big coalition. A lot of the folks who were leading the space and leading the conversation about the bill were primarily white folks. And I knew that there was an opportunity, because health equity isn't everything, that health equity needs to be infused in even the technical health policy, healthcare reform. All of these bills have an opportunity to infuse health equity in community, and I wanted to make sure that happened.
I love that. And maybe even like talking about how did you navigate that as a young professional coming into the field, being someone that was maybe not like the others, or maybe had this perspective that was different from the others.
Yeah, I think, like I was saying before, I think I've always had that sense of here are my values and knowing when to be open, but also when to really stick to my own lived experience. And my lived experience as a Black woman. And I was really fortunate to have mentors who were in the space, who had been there longer, who were women of color, who really supported me in, speaking my mind in these spaces and pushing back and challenging. Because I remember one time, one of the coalition meetings, as I'd been pushing for more health equity, there was an expert brought in from the University of Michigan, and it was this white male expert on value-based healthcare. And I asked a question about how do we know what is value for people of color? And his response was, well, we have data on low-income folks. And I was like, wait, that's not the same thing. This is like some expert on this. And in his mind, people of color equals low income. Like, we don't need to pull this out. And I realized that moment, this is what creates our laws, and our systems have this kind of mentality baked into them.
That is definitely a disconnection, as well as like just looking at any group as a monolith that definitely doesn't serve anyone. So I'm glad that you were able to be there to advocate and to really like just create a lens of equity when doing this work, which is so important. And then shifting to talk more about the importance of fostering inclusive spaces for community-led decision-making in the policy process. You've been on the steering committee for the Cover All Coloradans legislation. Can you tell us about the importance of that?
Yeah, so this is something I really wanted to work on as I started working in policy, because I learned that undocumented immigrants don't have access to healthcare. And so the Cover All Coloradans, as my role in it started, was about ideally covering all Coloradans, and particularly focusing on getting coverage for undocumented immigrants. And what shifted because of political will and money was we got to a place where we were focusing on covering children. And that decision was made by community leaders of Center for Health Progress, who many themselves are undocumented or have close family members who are undocumented. And, we obviously want everybody covered, but knowing we had to make a decision focused in on coverage for children at first. And then that effort got merged with another effort that was playing out at the same time, which was expanding coverage for undocumented pregnant folks. And so eventually we pulled those two together. And that was a big piece of kind of like the headline of the bill, but it does all these other things that I think are cool, but other people probably think are nerdy.
Nerdy is a new cool.
I like to tell myself that.
Yeah, keep telling yourself it. Keep telling yourself it. And I guess like in line with that answer, so you've worked to support over 10,000 Coloradans who were previously ineligible due to their immigration status. So we hear a lot about this, maybe in the news and just in conversations in public health. Maybe can you highlight why it's important that we ensure that these populations have health insurance?
Yeah, so I'll start off by saying, as I do often when I talk about my identity, that I am not a recent immigrant. My family is not of recent immigration. And so I really try to have space and have the folks who are experiencing that be in those leadership positions. But I see my role as supporting that. And why this is meaningful to me as a Black woman is that I think anytime we say that a group of people doesn't deserve things like healthcare, that a group of people can literally die because of a piece of paper, I know as a Black woman that can ultimately impact me as well. And these things are not separate. So if we can say some people are less than human and don't deserve care, that can eventually and likely will mean Black women don't deserve care. And it does in this country often.
Yeah, an injustice anywhere is an injustice everywhere, as they say.
Mm-hmm.
And yeah, so we all
No
have to.
one is free until every woman's free, even if her shackles are very different than my own.
Absolutely correct. Absolutely correct. And I think that's why it's important. We have to keep that focus and ensure that we are working together to address these health inequities. And I'm excited to like dig a little bit more into how you got this policy expertise and like really developed into this person and the professional that you are today. Um, so before we get into all of that and your career journey, I'd love to ask, what does public health mean to you?
Public health is everything, right? I'm sure we all learned that in school, but public health is everything. It's understanding that our health is not just about us as individuals. It's about the collective and what we invest in collectively. And that was a big shift for me. Like many public health folks, I wanted to be a doctor and have much respect for them. But I realized going into school for public health, there's so much that ties us together and determines our health. And that's what public health is about.
Quick break. Come join the public health community with a 7-day free trial. You'll get access to learn, navigate, and transform your public health career through mentorship, coaching calls, resume, cover letter, and LinkedIn workshops, exclusive videos from yours truly, and much, much more. If you've been looking for career support, mentorship, or want to build your brand, look no further. Join the public health community today for a 7-day free trial at thephmillennial.com/join or from the link below. Let's build a stronger public health community together. Now, back to the show. Absolutely. And you got your bachelor's in science in public health at the University of Arizona. I believe you were an intern at SSA before going into your bachelor's degree. So maybe tell us about that experience as an intern at SSA. Tell us what SSA is. And then about that thought process. Did you know about public health? How did you come across the bachelor's of public health?
Yeah, so SSA was and maybe it still exists, but a small firm that was actually treatment for sex offenders, which was my plan had been to go into psychology. And so it was an opportunity to work with therapists in an office and understand their work. As you can imagine, it was very hard work. And there were a lot of difficulties with it. It wouldn't be my career choice, but I feel like it really challenged me again on that like understanding and being curious about where people come from. So then that was actually in Portland. I had moved back to Portland temporarily and then moved back to Arizona and went to the University of Arizona. And I still was planning on being a therapist, and I am terrible at math. Yeah. I was like, I'm going to take all these classes I had to take that were math classes, and I just couldn't pass them. And I was like, what am I going to do? I can't quit. So I found public health, which required fewer math classes. And then I got into it, and I was like, oh, this is actually really cool. This is what I've been looking for. This is talking about things in the way that my brain thinks about them. And so after that, I was like, public health all the way.
Okay. And did you have any guidance in like finding public health, or was it just that you were like looking for alternatives that kind of were like sciencey, psychology, and then found public health?
I think I was like, what can I do that my credits will transfer? I was like junior year, like, what can I do where my credits will still count and it won't be a waste of money the last few years? And then I went to an info session and I was like, oh, this is actually really cool.
Well, thankfully you fell into public health. I'm glad that you made it here.
Me too, yeah.
And while you were in your bachelor's, you had a research assistant position at clinical psychophysiology lab and a health promotion intern at the Canyon Ranch Center for Prevention and Health Promotion. Can you tell us about those experiences?
Yeah, so my research experience was back when I was still in psych. I was still a psych major. And it was a fun, weird thing. It was like studying, brain activity. It was like a bunch of like undergrads, research assistants helping determine whether or not the PI wanted to actually move forward with this study. And so we were like literally the guinea pigs. So, like, we had the EEGs on. I would go home every day and have like this like gross like gel that you put on your hair. And I'd be on the bus and my hair would be all stuck up with like weird gel everywhere. And I'd go home and wash it out. But it was fun. I mean, we enjoyed it. I don't think it actually went into an official study. But I learned a lot about the study process. And I think just knowing not everything is going to work out is also good to know. And then when I started shifting into public health, I started working and focusing on health education, and particularly focusing on food access and educating about healthy foods. I'd grown up, my mom was a teen mom, and I'd been on free lunch program, been on SNAP. And I remember when I was like 17, I had a fresh green bean for the first time, and it was like life-changing to me. And so I wanted to bring those experiences to other people who had grown up similarly. So I did a lot of outreach and education about food as medicine in my internship with the Canyon Ranch Center.
That's awesome. And then, like, thinking about your entire experience in undergrad, as well as those two experiences, and I guess maybe the other things that weren't on your LinkedIn, were there any like huge undergrad takeaways that you wanted to share with us? Or smaller undergrad takeaways? Doesn't have to be huge.
Yeah, I mean, I did so many community events, and I felt like that was really valuable and something that I ended up continuing as I left undergrad, like looking for those community opportunities, because I just loved connecting with people and meeting people where they're at and not just focusing on like, brass tops kinds of things. So yeah, that was the most impactful to me, was just being able to connect with people from all over.
Well, yeah, thank you for sharing that. And then after you graduated from undergrad, you became a data manager at the University of Colorado Anschutz Medical Campus. So tell us about that experience and getting into that position.
Yeah, that also feels like a side quest. So that was, I applied for like 50 jobs as I was finishing up undergrad, as many of us do, and this was the one that I actually got. And I didn't really know what to expect. I lived in Arizona at the time and was moving to Colorado. It was a position on I believe, NIH funded project that was through the Indian Health Services, that was about education and outreach to tribal communities around heart disease and diabetes. And so I was working on like intaking the data that was being sent to us from all of these different like tribal nations, and cleaning through the data and making sure we got what we needed. Was not probably the best role for me. I am regularly like, I can't believe I didn't get fired. I was probably pretty close. Really cool work, but it was a lot of being in front of a computer and being in an office all the time, which is not me.
And I think that's good to hear from people. I'm glad that you didn't get fired, but considering that you're reflecting, you're like, I was so close to being fired, and like just hearing the trajectory of you coming out of undergrad with a focus kind of like on food systems and food work, and then going into this data role. How did you like pick up the skill sets to do that role? Was it something you picked up in undergrad, or like just through working?
I mean, I think maybe I didn't pick up the skills. That might be
Okay.
why I was so close to getting fired. It
Gotcha.
was so much of a, when you're like graduating and you're like, I can't find, and everybody around me like can't find jobs, and you're like, let me just get this thing, and hopefully it works. It was, I think the most I brought to it was an understanding of the interconnectedness of systems and of being in Arizona. There was a lot of focus on indigenous communities and diabetes and like systemic racism. And so I brought that lens into that space. But I think that's probably the extent of my skill set there, because there's a lot of organization, and that was not me.
Understandable. And I believe you were promoted at the same organization into Healthy Kids Colorado Survey Project Coordinator. Can you tell us about that experience?
Yeah, so I actually applied for a different job at the university when I realized this was not meant for me. And so I got this job on a different project in a different department at the university. And that was really cool. I was there for, I think, 3 years. And I was working on, so there's the statewide surveys that are funded by the CDC. And I believe they're called something different other places, because ours is Colorado branded. But it's research of high school and middle school students about health behaviors. And so my job was really helping coordinate the sending out all of these surveys, like thousands of surveys across the entire state, and then getting those surveys back, cleaning the data, getting the data uploaded, getting them scanned. We were using physical paper surveys still.
No.
So kidding. I just like stood by a scanner a lot and then cleaned the data that, inevitably would have mistakes and things. And doing reports. And I got a couple opportunities to be in community, particularly with youth, and talking to them about the survey and like what questions they had and what they want to see. I feel like it was a really cool experience.
And how did interacting with the youth kind of inform maybe not the work, but maybe your approach and how you moved forward doing public health work?
Yeah, I think the like disconnect that I heard between what youth were saying and what we were asking, and like there would be things where I'm in person with them and they're bringing up things that are happening, or sometimes they would even write stuff on their surveys. Like it's a multiple choice, right? There was no free writing, but they would write stuff anyway. And it made me realize we do this work sometimes in public health without talking to the people we're trying to help. And when we do that, we aren't actually getting to the root of the problem. We're not actually getting the thing that we want. And so I feel like that helped inform that piece for me.
Yeah, that makes sense. I had a similar experience when I was in Alaska for my community health fellowship, and just looking at the big data sets. And then I did a group, like I did focus groups on like photo voice, and just seeing how a lot of the themes particularly didn't even have questions that you can really get to what people are trying to say is important to their health. And I think, like, to your point, it's so important that we are trying to find ways to co-create these surveys so that we can get to the bottom of the needs and what people are actually saying, and not just like what we think they should be answering questions around specifically. So appreciate that. And then you went and got your Master's of Public Health in Health Systems Management and Policy at Colorado School of Public Health. So tell us about that thought process.
Yeah, so I got my degree. I started off while I was still working at the university. So I got employee benefits, which I really needed to help pay for school. And I originally was actually in community and behavioral health was my plan. I couldn't imagine why anybody would go into policy. I'm like still trying to remember why I even made the switch. I think, well, my plan was to actually go into hospital management, which sounds funny now, given what I do. So I switched into policy. But I remembered undergrad, I had taken a lot of classes on the U.S. healthcare system policy work, and then doing this in grad school. And for a long time, my policy classes were all about read about what somebody else has already passed. And I was like, this is the most boring thing ever. Like, I don't want to just read this bill. And it was this shift for me in some of my coursework where I realized it's about creating the systemic change. It's finding these things and these values into law that actually helps us to make the changes we want to see. And that's when I got excited about doing policy work.
That's awesome. And yeah, that lens is so important because as we know in public health, or as you grow to know in public health, it is the systems and the policies that oftentimes shape the environment and the structures that are around us that allow these health inequities and exacerbate a lot of these health inequities. I didn't want to miss out on part of like the employee benefits because I would love for you to talk about that because I know a lot of people right now are thinking about getting a master's of public health and maybe thinking about how to do that cost effectively. Can you please just like talk more about your thought process there, if that was intentional or not? Or
Yeah, I mean, I was already working at the university and I kind of already knew I wanted to get a master's in public health. And I didn't know at first that I could get employee benefits. And I think it was actually my supervisor who had mentioned it to me. And so, I applied and was going part-time. One of the things that was great was that classes were like next door from work. So I didn't have to like, go somewhere else. I was already on campus. I could just go to class and then come back. And the program became 3 years instead of 2 because I did it part-time so I could continue working. I did before the end of my last year, or before my last year started, end up not working anymore just because it was so hard for me to focus on the coursework and practicums and capstones and all the things we have to do. But I mean, I think I ended my grad school program. I also got a scholarship, but I ended my program with having spent about $3,000 out of pocket total.
I'm gonna cut that up. But that's important. That's important for people to know because I think like so many people don't know the avenues that they can go about trying to get an affordable education, and so I'm glad that you're able to share that because it might be so helpful for other people, as well as I appreciate you sharing the reality of like doing it part-time while also understanding that it was hard and that last year you really needed to just do the schoolwork as opposed to like working because it is a lot of work and there's no doubt about that.
Yeah, and I'm very fortunate. Like I have privilege around having a partner who could help manage, the costs of things, and so want to like acknowledge that I know it's not a reality for everybody, and that's disappointing. It definitely should be.
Yeah, absolutely. And I think like once again, there's a lot of policy work that can be done to change the schooling system here in the US, but that's a whole other podcast conversation. So
We'll just
while
use
you were
the system.
right. So while you were getting your master's of public health, you were an MPH intern at the Children's Hospital of Colorado. Tell us about that experience.
Yeah, so I ended up working on food issues there, food security. And I had my plan, like I said, was to go into hospital management. And my mindset at the time, and I know a lot of folks have this mindset, was I would get into the systems and fix the problems from the inside. For me, I ended up finding that didn't work. So I did this internship, and I think it was great people doing really great work. Worked on building a vegetable garden at Children's Hospital. And I remember the opening ceremony was this whole big thing with like the CEO of the Kroger brand in Colorado was King Soopers. It was like the CEO of King Soopers came out in news media for this. And then I did my capstone project and focused on food insecurity among employees, particularly employees of Children's Hospital who are in lower wage jobs, and found an overwhelming amount of the employees, namely employees of color in those departments, were struggling with food insecurity and even being unable to feed their own children. And around that time, I'd also found out that the executives at Children's Hospital had gotten $250,000 bonuses. So it shifted a thing in me around, why am I trying to be part of running this system that is set up this way? We need to change the way the system is set up.
That was one of my biggest fights with in my Master's of Public Health program. We did a lot of classes with MHA students, and a lot of the case studies would be around those types of things, and they would just be, I don't know, kind of disconnected from reality, and as you're saying, like the employees without being able to like feed themselves. I was talking to one of the co-founders of Brothers in Public Health, and he works at the health system, and he shares a lot of those same sentiments and just the disconnect that does happen. So I'm glad that you're able to raise that up.
Yeah, I remember, in my policy classes, and continue working with the School of Public Health, their HSMP department, but I took classes that were all about how do we make hospitals money in public health, and I thought that was normal. Mm-hmm. And it wasn't until those experiences that I was like, wait a second, in public health, like we should be using the research we have, cost benefit, all of these things to help communities get healthcare, not to help make hospitals money. There are MBAs for that.
Right. And we are in a interesting, I don't know, space in the US, because when we think about the populations that have been most marginalized, most disinvested, oftentimes they're the ones that suffer the most amount of ailments and need access to healthcare while they don't get it in many circumstances, while we have these huge corporations that are businesses that are just running to treat people, and there's lack of investment into the community, into prevention, into public health, which is just continues to this. It is a cycle of healthcare in the U.S., unfortunately.
Yeah, and many of those, especially when we talk about hospitals, at least in Colorado, are nonprofits. And so when we talk about corporations and corporate greed, we're also talking about some of these nonprofits, and they're supposed to be paying back, to your point about investing in communities. They're supposed to be putting that money back into communities through community benefit because of their tax breaks. And what we're seeing here in Colorado is that they are not actually putting that money back into communities. They're reinvesting it into their own hospitals.
Late stage capitalism.
Yeah. Fingers crossed.
Right. Yeah, that's why we have to have these conversations and have to like be knowledgeable about it, so that we can continue to see how we can shift those systems and shift that 20% GDP into more public health, into more prevention than our healthcare, because we know that the outcomes that it gives us is not the best, especially for people of color. Mm-hmm. So were there any big takeaways that you wanted to share from your MPH program?
I mean, so the way that I got my job and I got into policy work, I think is actually an important takeaway from public health and being in school. I actually had just made a joke to one of the people who I was in my program with, that I was still trying to find a job. And she was like, oh, here's this job that's opening up in policy. Here you go, and help facilitate that connection. But I think what's important there is you don't know where people are going to end up. You don't always know all the things people around you know and who they know and who they are connected with. And so keeping an open mind and building relationships, and again, remembering that you don't make assumptions, right? Like you don't know who is listening and who is in the room. And so leaning on those connections can be really powerful, because I probably would not be in this right now if I had not made that joke.
And I think to that point, it's so important to just have those conversations and share those candid moments with people that are in your cohort. Because like to your point, you literally never know where someone's going to end up, or who they have a connection with, or how they might be able to help and support you in the near future or the future. So just like be kind to people and share your interest, and just really try to build those relationships. So you got a role as a health policy analyst at the Colorado Fiscal Institute. Tell us, what did you do in that role?
So the Colorado Fiscal Institute is a tax policy think tank in Colorado, and focus is primarily on tax policy we have here in Colorado called TABOR, which severely restricts our ability to raise revenue without it going to the ballot. And most people are not willing to vote to raise their taxes. So it's made it really hard for us to do all kinds of things in Colorado that most states can rely on public funds, including it's being a barrier to us having universal health care in the state because we can't raise taxes to pay for it. So my work was around healthcare and the intersections of health policy and tax policy. And then I also worked on some environmental justice policy, including supporting a group here, the Colorado People's Action, on a bill that would put community money from environmental violations by a oil refinery, Suncor, into a community fund that would be spent by the community. I think that got into my head and then informed a lot of the policy work I ended up doing later.
Okay, and before we get to that, talking about that challenge, that definitely does see the table challenge of having to go to the ballot to actually increase taxes to be able to pay for things. What are some of the I guess the ways that Colorado is trying to work around that, or is it just a deficit in those tax dollars that they are trying to collect in that way?
Yeah, I mean, I think it really has continued to be just a deficit. I mean, we tried to take advantage of whatever federal funds we can get as a state, try to think creatively about how we can get donations for things from institutions, but it's really tied our hands, not just in healthcare, but across the board. I mean, our schools are underfunded. We can't pay for, public transportation, all of these projects that we don't always think about how important taxes actually are to public health. And we can't accomplish a lot of the things we want to accomplish, at least statewide, because we can't raise the money to do it. And so there's a constant, in the legislative session, a constant competition between different groups and between different legislators of everybody trying to fight for their priority to get funded because there's limited funding.
Right. Well, definitely keep that on top of your head if you're thinking about going to Colorado and doing work in Colorado. We need some brilliant people out there to figure that out as well.
Yes, please.
So you spoke about the Sunoco and environmental health and how that kind of shaped your next career move. You were policy manager at Progress. Can you tell us about that shift and maybe how that informed your move?
Yeah, so I will say I wanted to work at Center for Health Progress when I was an undergrad. And I joke all the time because my boss knows my advisor from undergrad or from grad school, sorry. And so he knows my advisor from grad school and she made a connection for us and he didn't read the email. We worked together for 4 years now, so I can make this joke all the time. But so I tried to get a job here and he had me meet with somebody who had an internship and not actually him. And I basically was just well, I'm gonna figure out how I can get a job there. Because it was, to me, the only organization I saw in Colorado that aligned with my values and the way that I want to do work. So I had some connections with folks and continued, again, relationship building over the year that I worked at the Colorado Fiscal Institute. And then when a job opened, I was yes, applied. Very, very excited to be working here.
Sorry, I missed your email.
We talk about it all the time.
I'm glad that you're gonna have fun around that. So thinking back to you saying this was an organization in undergrad that you were very interested in working with. What about the organization then and to now has been something that really excites you?
Yeah, I'm sorry, I misspoke. I said undergrad, I meant grad school. So what about it really, I think, is that there's always been a focus, at least since I've been aware of the organization, around health equity, health justice, and those things being named really clearly, I think, before it was kind of popular to do so, which I think now is becoming more popular, especially following, 2020 and George Floyd's death, that, more and more groups are putting an equity statement up. But the fact that Center for Health Progress was already talking about this, they were also really central in expanding coverage for undocumented immigrants through emergency Medicaid for folks who have kidney disease and getting access to kidney transplants for folks who are undocumented. And so that was some of the research I found when I was in grad school in my last year. And I'm telling you, all of this happened. My decision to work in policy happened in the last 2 months of grad school. So it was all like shifted really fast. But I read their research and what they've been working on and was like, yes, that's what I want to be doing.
Yeah, and maybe like even talking about that, so like that late shift in grad school from health administration to wanting to be in policy to then entering into the policy workforce and then coming into your second position in the policy workforce, like how did maybe your perceptions of what that would look like and the reality, like was there a disconnect? With things very aligned?
Yeah. So, I mean, first thing I always have to share, now that I'm further along, I can share it. When I got my first job in policy, I literally the night before Googled, what does a policy analyst do? I had no idea. Like, I had no expectations. You know, I knew about US government, but like didn't really know much about state politics and what can you even do at a state level. And so I had no idea what I was getting into. But it's been amazing. I mean, I feel very passionately about this work and about bringing more, particularly people of color, into this work, because the ability to sit in front of legislators and, first of all, just even testify and like share your story and share why this law means something to you, but the ability to have an idea of how you want to change the world and to be able to make that happen and make it happen across a large group of folks. Like, there was not coverage for undocumented immigrants, and there is now. Not 100%, we still have work to do, but, you know, it's different than having, like, helping one person find access to a sliding scale clinic. Like, we're actually making sure that folks have that access. And so it's been really powerful for me to be part of this work. I think what's been very eye-opening is the reception I get as a woman of color, as a Black woman in policy spaces, and folks kind of not expecting me to be there, and not expecting community members to be there. And so that's been pulling the curtain back and seeing kind of the ways these decisions are made by particularly white folks, white men, without really a lot of interest in having communities of color at the table, has been really eye-opening for me.
Well, I appreciate you sharing that, and I think it's so important that firstly, thank you for being in those rooms and for advocating and trying to get more people like yourself in those rooms, because as we know, the systems have been created by the people that are in power, and without people like ourselves being in those positions to kind of advocate for our communities and share that like these are important issues, oftentimes those communities get left behind, and thus the health improvement efforts are just not as good. So it's definitely very important, especially when we think about policy and just how great that impact it can have on populations is. So glad that you're able to do that work. Glad that you made the switch and that you're doing great work now. And so getting back to you currently work at Center for Health Progress. Before we get to your current role as Director of Political Strategy, what did you do as a policy manager, and what did you do afterwards as a senior policy manager?
Yeah, so I'm trying to remember my timelines. So actually, a lot of this work that I've continued to work on started when I was at the Colorado Fiscal Institute. And there was an opportunity to work on a bill that, to your point about how do we address raising funds when we have TABOR, it was a bill that created something called an enterprise, which is a provision in TABOR where you can raise money. And it's money through a fee. And so in this case, a fee on health insurance plans and health insurance companies. And so that money partially goes to fund the Omni-Salute program, which is coverage for undocumented immigrants. First program in the country that is private health insurance for undocumented immigrants. And so that's the program that's covered the first year, 10,000 people, the next year, 11,000. So I started working on that when I was at the Colorado Fiscal Institute because of the TABOR implications of it, and continued that work as I went to Center for Health Progress. And then that first year I worked at Center for Health Progress, the Colorado option work began. And so that was where I really, as a policy manager, I worked on shifting really the conversation in the Colorado option to one that centers health equity. It centers communities of color, expanding coverage for undocumented immigrants, things that, were innovative. Like, I don't know, how are you going to make a health equity centered insurance plan? But I was like, it's important we have this legislation, this huge bill. When are we going to get another opportunity to try to do that thing? So that was a lot of what I did as a policy manager at the time, was focus on that and helping build up Center for Health Progress and our reputation at the Colorado Capitol.
Well, that's awesome that it would kind of like build off of the previous role into this role and then just really like digging deeper into the same work. And oftentimes that is what happens in public health, because the issues that we're dealing with are here for a long time, and like we need to be persistent in various different positions to kind of like get at them. You mentioned that you had to Google what a health policy analyst was. So you were a health policy analyst, you moved on to policy manager, senior policy manager. Maybe what are some of the key skill sets that you would advocate for someone that is interested in a role like those roles should try to attain?
Yeah, I mean, I as somebody who works with community members to get folks comfortable working in policy, I feel like everybody has the skills they need to advocate for themselves and their communities. There is a level of extroversion, even temporarily. Like, I can be very much an introvert on the weekends, but I have to be able to talk to people and like be passionate about things. There's writing involved. There's public speaking, testifying. Being creative, I think, is an underrated skill in policy, because like these things we keep saying, like innovative, first in the nation, like that wouldn't be a reality without having creativity that you're able to bring, because these are problems we have to come up with a creative solution to solve. And like an ability to work with other people, but also, again, going back to that, like having your values and what you believe in, because it's going to be a negotiation. It's going to be a fight often, and you have to know what you believe in so that you can work with people, but also not get swayed by the political winds.
That I appreciate that. I think that that's important to really like have a values based approach to the work that you're doing, and I appreciate you sharing those skill sets for anyone that is interested in getting into policy work. And I do also I say appreciate a lot, but I do appreciate you also seeing that everybody has like a part to play in the policy thing, because I feel like too often we say like, oh, it's for someone else to kind of deal with, and that kind of neglects the power that we have as an individual, as a community, to kind of collectively come together and say, these are the things that are impacting me, my family, my community, and these are the ways that I really want to advocate for that change.
Yeah, I mean, that's the most meaningful part of what I do, to me, is working with folks from communities who didn't see themselves there to challenge themselves to show up and be there. So I think we all have a role to play. That's what democracy is about.
Right. Yep. It's your tax dollars. We gotta be there to hold those systems accountable to how we can like make that impact and bring those dollars to the communities that kind of need them, because they've been disinvested and marginalized for decades, if not centuries. And then currently, so you're the director of political strategy at Center for Health Progress. What do you do in that role?
Oh my gosh, so many things. So I also, in this time, since I became the director of political strategy, Center for Health Progress moved our model. We always had organizing work, or for the last several years had organizing work and policy work, and now we are a power building organization, which is slightly different than those things and has, I think, more terminology and like there's methodology around that. But part of my job is organizing. So everybody on our staff, aside from our office manager, is organizing community members. And so I have a team of community members who are not, it's not like you have to have already gone to school for public health. It's just people who care about their health, who are being impacted by our systems. And we organize those folks to take on develop campaigns and take on the healthcare system to change it. And so a lot of my work is around the organizing pieces, and then a lot of training, and particularly like the more specialized trainings that I do with community leaders is stuff around the healthcare system and understanding systemic racism and like how do we get to the healthcare system we have today, and who are the players, and how does power operate in politics and policy spaces. And I support community members in testifying and being part of deciding what bills we support. So many like really exciting things that I get to be part of.
And what do you like most about your role, and what is the hardest thing about your role?
Oh my gosh. I mean, yeah, I love working with people and like just seeing the transformation, I would say. I think about the transformation I had from somebody who was so afraid to be around people in power, or even who had perceived power. I wouldn't even talk to them. So going from that to what I do now, which is regularly holding people in power accountable, often to their faces, and being like, you know, that's a shift. I love watching other people go through that and supporting them in overcoming the things that are getting in their way. Because I believe, like, I want more to change in our society than just about healthcare. And I don't think we can get there without, particularly communities of color, rediscovering the power that we have. And I am very fortunate to be part of that process. The thing I don't love is, as a woman of color, as a Black woman, there's very few people of color, definitely Black people, at least in Colorado, who are working on healthcare reform. And, you know, folks are working on maternal mortality, on health equity, but I don't have a lot of folks around until we, you know, now bringing in community members. And so the expectations and, you know, the white supremacy culture stuff is rampant in healthcare reform. And the idea of what change can happen is really narrow. And I've experienced a lot of misogynoir being in this space, and had, thankfully, people who have been in similar positions who are, you know, allies, like, I've never gone through that. You're going through that because you're a Black woman. Like, this is not how people are treating me. But it's hard. It's the thing that I'm like, maybe I'll just go and like run a flower farm because I don't know if I want to do this anymore.
That's real, and I think that's part of like the white supremacy structure, is like just making things inherently harder, more stressful for people of color to show up in these structures and like advocate for their communities. So once again, thank you for doing that work, as well as like a huge advocate for taking your rest when needed, and on all of that. We need you for the long run.
Yeah, I've gotten much better at that. I have to shout out. We have a program here in Colorado called the Transformational Leadership for Change, TLC Fellowship, for BIPOC leaders in Colorado. And it's been so helpful in supporting me around how to take rest and prioritize rest and myself to be in this movement for longer. So yeah, we need that. We all deserve rest.
Absolutely. Absolutely. And before we move on from this role, like, you have been at the Center for Health Progress for a while now, moving from policy manager to director of political strategy. What kind of advice do you have for people that might be trying to make those kinds of like upward movements in their career, in a policy career?
I mean, I think be your advocate, be your own advocate is important. Again, I think those are skill sets that are really crucial when you are interacting with people in power in general, but just knowing what you bring to the table. And it can be hard, especially as people of color, to advocate for ourselves. But I know when I interviewed to be the policy manager, I said in my interview that I wanted to be policy director. And so I was really clear from the beginning that this was a plan for me. And I continue to advocate for myself. And I continue to do innovative work, not because anybody asked me to do it, but because I believed that was what needed to happen. Center for Health Progress had never run a bill before. And so Cover All Coloradans was our first bill that we'd ever run. And to run something that is going to cost tens of millions of dollars in Colorado and have it pass was really cool. And it came out of me being like, I want to do this thing. And so I think that's a big piece of advice. I think often we are afraid to not just ask, but demand what we deserve. and that keeps us small. Like, I just don't believe people are ever going to hand you power.
Absolutely not going to hand you power. Power is always taken.
Yeah.
So you are the board chair at Health Insurance Affordability Enterprise. Can you tell us about your role there?
Yeah, so that is the enterprise that was created during my full circle moment, right? First role at the Colorado Fiscal Institute. The enterprise board was created to oversee those funds in the enterprise and create the programs that are creating coverage for undocumented immigrants and making healthcare more affordable for folks who are low income, who are not undocumented. And so I've been on that board since it began in, I believe, October of 2020. And it's been, at the beginning, it was like a bill passes, and often what most people don't know is in those bills, there's all of this other work of implementation that is left up to the agencies. And it doesn't say all of the things about what this has to look like. And so our role early on as the board was creating a lot of the structure of what the programs to make health insurance affordable were going to look like. Now for me, my role is a lot more about bringing in community members and shifting who is at the table and who we're listening to, and trying to make it actually representative of the people who we are serving as a board, rather than who we see as traditional experts.
And then before we move on to the Furious Five, I'd like to ask, where can people connect with you, and where would you like to see yourself in the future?
Well, people connect with me through email. You can connect with me on LinkedIn. I'm starting to make some videos on TikTok. So for anybody who is also a health policy nerd and wants to learn more about how power is held in our healthcare system, I feel like there was a part of the question I missed.
Where would you like to see yourself in the future?
Ooh. Oh, man. I don't even know. I probably still doing this. Like, I love it. I think I just want more of it, and I want more people to be part of this work. So I see myself in the future, I think, sharing these messages about the healthcare system more broadly and outside of Colorado, and helping support communities across the United States to fight back against a healthcare system that is taking our money and not giving us help.
Absolutely. Well, look forward to seeing all of that come true, and I will put the links to all those ways for people to connect in the description so they can connect with you. And I will definitely have to go and follow you on TikTok as well. And now moving you on to the Furious Five, the 5 questions that I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Ooh. Try everything. Yeah, try everything. You never know there's so many things you can do. Just try different things. You might find something that you love that you didn't expect, like policy work.
Absolutely. Number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
I think get your foot in the door wherever you can, even if it's not where you ultimately see yourself. People are really close-knit, and just getting started is sometimes the hardest part.
Number 3, what's something you are working on improving in your life right now?
Ooh, my work-life balance. Resting more. This work can be heavy and exhausting, so work-life balance for sure.
Absolutely. Number 4, professionally, do you recommend anything?
Ooh. I mean, I have so many books I would recommend. Purpose of Power, first of all. The Purpose of Power. I feel like that's such a good book about how do we make change.
Okay, I have not heard of that one. I will add it to my ever-growing book list. I appreciate you sharing. And then last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
Value what you bring to the table in your own unique way, because that's important. That's what helps make change, is each of us bringing our unique value to the table.
couldn't agree with that anymore. Thank you, Rayna, so much for coming on and sharing your expertise and your story with us. I greatly, greatly appreciate it. And I know it's going to help someone out there.
Thank you so much for having me on.
Yeah, it is my pleasure. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a review and share it with a friend. Greatly appreciate you all. See you all next week. Peace.